Okay, thank you guys for attending. This is today's webinar for this session is about SmartEnroll, which is the TLC online enrollment and quoting tool that you have the ability of using when you have any of your carriers, your Med Advantage or Part D carriers with Medicare Answers Now or TLC, you have access into the system. So what this particular system does is it's basically an aggregator. So think Travelocity, but for health insurance, or it's very similar to the Medicare Plan Finder. But it is designed so that it has all of your writing numbers embedded into this particular software. So the first thing that I do want to say is that you do need to go ahead and sign up for SmartEnroll. And that was in the contracts email or the contracting email that TLC typically sends out. It's also a link that I send or I've sent out and put in a hyperlink several times. With that, I'm going to put these in the chat box so that way you have them. But there is an agreement that needs to be signed off on to be able to utilize the system, which of course it does not do the hyperlink. So hold on one second. I couldn't get that easy. Hold on. Click here. There. Okay, let's try again. Click that link to go ahead and sign up for SmartEnroll. And I'm going to start sharing my screen. We have a super small group, which is great compared to the college or the class I just did 2 seconds ago. So please feel free to come off mute if in the event that you have some questions. So the SmartEnroll request is basically the link takes you here. It's going to pre-populate with the date. You're going to initial, you're going to sign, and basically it says that we are using the SmartEnroll system to house and quote your client's information and how that works. So you do this, you hit the submit, and then they will set you up with access. There is typically a link that you get that is for the plan year. So each year there is a different one. The one that I'm working on right now is the 2023 one. The one for 2024 will come out right at October 1st. They do not allow and they do not actually turn on the functionality for anyone until 10/1. So, but all of the information that is in your SmartEnroll for 2023 morphs into the 2024 one. So you don't have to rekey anything in. All the historical data will be there. It's going to be fine. So that is why you want to take a look at this. The other thing to note is that you get access to SmartEnroll based on your appointments for Medicare Advantage carriers. And the only way that you get access is if you're showing up on what's referred to as a ready to sell report for each carrier. So even though you have submitted your contracting and you have submitted your certificates of completion for your 2024 product trainings and stuff, you have to wait until it actually appears on the ready to sell report. So some of you are like, okay, well, I'm good. I've already submitted because I wanted, I submitted 3 of those completion report certificates on 7/21. So I'm done. I need access. Give me my access now. However, the carrier hasn't given us the updated report to show that you have a green light. And until they give us the green light, we can't give you your access, which is why I have said I want these done as soon as possible, because then we don't run into trouble where you're panicking close to 10/1 that you don't have everything that you need, right? So today we're going to go through this, and I'm going to talk to you guys on this as though most of you have never seen this functionality. So that's what we're going to do. Your username is always your NPN, always. And then you create your password. I default them and save them so that way I have them and I don't have to worry about them again. So I'm going to go ahead and click in and we're going to log in. And I'm going to show you multiple pieces on this so that way you have it. The first thing that this goes ahead and this does is we're going to go under the little dude that's up here at the top. And if we go ahead and we come under here where your name is, and we're going to go under account overview. You have the ability of putting in your picture. And you have the ability of putting in your information. So this has my name, it has my address, it does not have my office phone number in here, so we're going to update that. And then it has the address of the office in here as well. So I'm going to save that so that way this is here. Now, the other thing that this has is that, as you can see, it's going to house all of the writing permissions that I have for all the states, all the carriers, so that way anybody can do that. So the next thing that I want to go ahead and show you is that this link right here, this copy link, this allows you to put on your website a link that people can go to if they want to enroll or run quotes on their own. And your agent information is going to be embedded into it. So if I click into here and I go into the consumer side, okay, and shop online, if I go into this SmartEnroll that is on my website is actually the focus, the interface, so that if somebody wanted to run a quote that I don't know about, they can do it here. And as you can see, my picture's here, the agent, who it is, and it now shows you the address, the email and the phone number is right here. And then anybody can do this. So anyone can enroll here from this consumer site, but I'm still going to get credit with this link. Make sense? So that's how you get this link, is that you go to Amanda, account overview, set this up, upload your picture, make sure that the contact information, and then copy link. When it comes in October, I will actually have on that website 2 links. I will have one that says for 2023 effective dates and one that says for 2024 effective dates. So that is how you get your personal URL. You can put that link on Facebook. You can put this link on your signature lines if you want. You have the ability of doing that. Okay, so now let's actually talk about how this looks.
Can I ask you a quick question, Amanda?
Sure.
Can I give that link to Ken to put on my website, or I do it by myself?
No, you have him do it.
Okay. Yep. Thank you.
So I just email him. I hit that copy on that link. I put it into an email and say, hey, please add this onto my website, and then he will load it up. He's actually the one that did that on mine.
Awesome. Thank you.
Okay, so this is what your dashboard looks like. You have the ability of putting up activities so that way you don't forget who has to do what and how does it have to work and all of that. That's what this is for. The other thing that this does is this has the functionality that if you have the agency block that TLC subsidizes, the one that's the $35 that you get through new business at tlc.com or Vicky sets you up for, that has the ability, when you enter in a new file in agency block, it will automatically load that person as a person that is in your client list when you go to SmartEnroll. It has that functionality to roll up. If you do not have that particular SmartEnroll, and you have the one that's $65, or you have another CRM that you're using, then you want to manually go in and set up your new clients and get all of that. And I'm going to show you how to do all of this today.
And does it take the existing clients, not just new ones that you add?
I don't know. I have to ask if they added that functionality in.
Thank
So, so what we're going to do is we're going to click this button that says new profile right here. And we're going to start a new case. And okay. Kim, what's your zip code again?
93257.
Okay. And I am going to, and we're going to go ahead and do this. And you can enter in all the things. So I can put the email address, the phone number, the address, all the things that I want, I can put in here. And I'm going to go ahead and hit the save button. You also have the ability of putting in the Medicare ID numbers and the effective dates. I can also add if they are on an LIS or not, or if they're getting Medicaid, or if we don't know. So that's going to be in the eligibility section of this. Okay. So from here, what we're going to do is once I've gotten this file started, what we're going to do is I'm just going to put this as California. And then I do all of my test cases because you will not be able to delete test stuff in here. So I always put my play cases in with a test as a last name so that I know that they're fake profiles. But what you're going to do is you're going to come in, and the first thing that I need to do is I need to send a scope, right? So, and especially starting at 10-1, we need to do that. So now that I've got the file in and I've started this case for my new client, I'm going to come in and click in, I hit save, and then I'm going to hit continue to SOA. You have two options here. I can email a scope to somebody, or I can send it via text message. I also have the ability of going ahead and printing out the form. So if you are a paper person and you want to get a generic form so that way you have it to go ahead and use with your clients, here's where you do that. You can go ahead and you can download it right there. You also have the ability of doing in-person scopes of appointment by clicking that button as well. And then you can go through it that way. I'm going to actually go back to the other one because I want to show you how this works. Kathy Linville, what is your phone number?
812-593-5623.
Okay, so I'm going to put that in. I'm going to hit save. I'm going to go back into the scope of appointment. And now I want to text her a scope so that we can go ahead and we can have an appointment in 2 days. So I'm going to click this. I'm going to hit send scope. It automatically tells me that I sent the text message. I know that her phone's going to go off in 2 seconds. And this even allows me to follow up with this so that if I set the scope and say, okay, Kathy, go ahead, you got a text message, fill that out and please do it so that way I can complete this. But what's going to end up happening is if I need to check in a couple of days to make sure that she actually did it, I can put a follow-up task in here to see, did she really do this? So I'm actually going to do that so that you can see it on my dashboard. Hit close. And when she finishes the scope of appointment, and it's super easy on her side, she's going to check off all the boxes. It works just like the same one. She's going to check off the boxes of the products that she wants to go ahead and review. She's going to put in her name, her address, her phone number, her contact information. She'll basically hit submit, and then I am going to get an email, and I am going to go ahead and be able to update in my system, and it will say that she's gotten it done. So as you see, it now says this was completed today and she's got it good to go, right? So if I click into, let me see if this has actually appeared in my inbox. It has. So if I go ahead and I show you, which you guys are going to be horrified at my inbox, but if I show you, this is what this is going to look like. So you get notified via email as well as in the system, and then you can click the link to complete the scope. So flipping back into the actual screen. Now I click complete form, and this is my part. So I am the agent. I'm going to go ahead and put the office phone number in. What was the initial method of contact? Okay, and I can put a note that, okay, I met her at a sales event yesterday, and that's how this was gone ahead and done, and we're fine. We're going to reiterate the plans that we're going to talk to about it. And then I'm going to acknowledge that, yep, what I'm putting on here is true. I'm not lying about it. And I'm going to hit submit. Now this is going to sit in my active scopes of appointment for her, so that way it's good. Anybody have any questions regarding the scope of appointment process?
Would I be able to print it out and put it on my CRM?
Oh, the one that she signed?
Yes, yes, just to keep records.
Hit that view button right here.
Uh-huh.
And then when it likes me, it'll download the PDF.
Excellent, thank you.
And there it is. It's a full copy.
Awesome, thank you so much.
Okay. So
Yes.
yeah, you have the ability of doing that. And then that way you have everything that you need. Any other questions on the scope of appointment process before I move?
Yes.
No.
If we print that out, can we submit it with a paper app if we're doing a paper app?
Yeah.
Okay.
Except I'm going to show you how not to do a paper app.
I know.
Have
out
faith,
of my
Christy.
comfort
We're
zone.
going to work on this. I promise.
Hey, Amanda,
Yeah.
they have to fill in the address, or if you put in all their addresses, does it automatically populate it for them?
Automatically populates it, I believe.
Okay, thank you.
Kathy, am I right with that, or did you have to key it in?
I had to key it in.
Okay, so I'm wrong. You had to key it in. Other questions? Okay, so now we've gotten the completed scope. We're going to click into this button that says add preferences. Now that add preferences option, that actually you can do while the scope is outstanding. You can do all of these pieces without one or the other, okay? But this is just, I want to do a flow for you so that you can see how you can do this while you're doing it on the phone. Come on in. Thank you. And then you'll have, I so love you. So then we have the ability, my slushies are here. So, then you have the ability of seeing all the things that it can do. And then I've got it where it's segmented correctly. So we're going to click into preferences. I hate this particular conversation, this particular one. So I skip it. I think it's dumb. I really hate this one too, because it's trying to gauge, okay, how sick you are. I would ignore this one also. But now we're going to talk about doctors. Okay. So this has the ability to go ahead and load in, preload doctors in here. So because there's always a Smith, you want to have the zip code where the doctor is, not where they live. So if you need to change it, then fine. And as you can see, I just loaded them in here, right? So now let's go with another one. And let's go with the shrink, because I need one. No. And then let's go with.
We all do.
Exactly. Therapy's a good thing. We know this.
Yes.
So now I'm going to go ahead and pull the last one out. So let's say she's got a podiatrist too. And then you can see that this one has multiple locations. So you want to make sure that you pull the right location that this person is in and add them. Now, as you can see right here, I can choose to set them as a primary. Here's the thing that I need to caution you. Even though I can set the primary care for as a psychologist and as a podiatrist, we all know that that is not true. Those are specialists that cannot be deemed as a PCP. So as I'm having this conversation, because you'll have people that'll say, oh, I want to go ahead and designate my surgeon as my primary care, or I want to designate my cardiologist as my primary care. You cannot do that. But I'm going to go ahead and put Charles as my primary. Now we're going to do drugs. So the first thing that I want to show you is this. This blue button or this blue section right here, this is referred to as blue chip technology. What this is that if the senior or the beneficiary has a mymedicare.gov website profile, that profile contains claim data regarding the prescriptions and the stuff that they've had previously. You have the ability, if they go ahead and they've given you an email and they have one of those profiles, which more and more seniors have, you can put their email address in here, send them the email so that they can authorize that you are talking with that profile and it's getting updated with what their claims experience is with their medications. Super, super cool. The other thing that this does is that you can start loading in the medications that somebody is taking. The first thing that I want to tell you is type slow. So the reason why is that just on the second letter, it's going to start pre-populating different medications that this person can possibly be on. So let's say that it's the simvastatin, right? So all it took was 4 letters, and now I don't have to worry about whether or not I can read somebody's handwriting or if they spelled it correctly. So I'm going to click into the prescription. I can choose which dosage that they're taking. This is always going to default to whatever the common one is. You have got to ask your client what their medications are and what the frequency is of those meds. So it may be that they're doing 2-a-days on these. So it's 60 pills every month, but they're not doing this every month. The script is actually written where it's 180 pills every 3 months. Okay. Or it may be where it is a tube of cream once every 6 months. So you want to make sure that you key these in. Do not ever guess on these. Okay. So then you've got other ones.
Amanda?
Yep.
I just wanted to make a comment because this has come up a lot for me, is that I have clients on PRNs and then I'm asking them to estimate how often they're getting it refilled in a year.
Yep. So you want to have a ballpark, and then when you talk to them, you basically tell them this is a ballpark based on the information that you provided to me. This is the ballpark of what we have. Drug costs, and I'm telling you, for anything drug related from this year, from 2024 forward, anything that you do that is drug related is an estimate. It is not hard and fast. And this is going to be a pain point moving forward as the new regulations and everything have been done. Okay, so I'm going to key in a couple of these other ones. So let's say she's on gabapentin. She's doing 90 pills for the month. And let's say they're on Atlantis. And it's a vial. And let's say they are on they're on a flex pen because they seriously have diabetes. And let's say that we've got I need a cream. Anybody got a name for a cream name.
Estrace or estradiol.
There we go. Okay, so do you see what I mean by there being 9,000 different ways that this is done? So when you look at this, okay, this is the tab, this is a tablet. Then you've got the patches, and then you have the gels. So and then you have the dosage of that gel. You also are going to have, how is it packed? Is it packed in, how is it packed? So some, it'll be packed like the Lantus. It was it's a pack of pens. Or it may be where it's a box of gels and they're break off tabs. It depends. So you want to make sure that you're entering this information in correctly. And then we're going to hit add. So now that I have all of these meds in here, we're going to hit continue. And then I'm going to pick a pharmacy. So let's say she does CVS. And let's say she does helps if I can type. And the Walmart. So now you can see that I've got 2 in here. These are retail pharmacies. You want to enter these in, even if they tell you that they use mail order, your response should be, okay, well, I get that you use mail order, but when you need a script because you got a cold and you need to go and pick up the antibiotics, where do you go to get your antibiotics? That's how you ask that question. And then you want to look at it. Okay, so this one, we're going to default it as the Walmart instead of the CVS because Walmart typically ends up being way cheaper than CVS. And then we're going to go ahead and hit continue. And now based on the doctors that I've loaded in, the drugs that I've loaded in, and where she lives, now I have the ability of looking at all the plans. As you can see with this, you have several things. The first one is that as a best practice, the first thing that I want you to do is click into where it says add non-licensed plans right here. And I want you to click that. And the reason why I want you to click that is when you're working with your client, I want you to be able to say, okay, Sally, I ended up looking at everything in the market for you, and this is what I came up with. And that allows you to do that by hitting this button. If you're only looking at the stuff that you're licensed for, well, you're not able to give a true non-partial understanding of what's going on, right? So we add this in, it's going to update. Okay, and then it's going to go ahead and it's going to automatically do this by plan premium. It's going to default to the PDP. I want the Advantage plan. And I want the Advantage plan with the drugs because, well, she's on them. So the next thing that I want to do is I want to change this. Now, traditionally, I prefer doing this by total estimated drug cost. And the reason why I do that is we can't determine how often somebody's going to the doctors or if they're going to have a hospital stay or something like that. So I don't think it makes sense to do that. But I can get a ballpark on what the drugs are going to, or how the drugs are going to be covered and what that exposure looks like. So I'm going to click into this and it's going to readjust everything if need be.
I have a question.
Yep.
Total estimated cost, doesn't that just factor in the premium plus the drug cost?
No, it factors in those 2 things that I skipped at the beginning about how healthy are you and what are you focusing on when you're trying to buy a plan. We skipped those 2 pieces, it defaults and adds in that, oh, well, you know what, so the average is that somebody goes to the doctor 3 times a time, you know, and the person that is 70 years old is typically going to have 1 hospital stay, and it's going to calculate in all of those numbers that are all hypothetical, which is why I think it's awful.
Really?
Yeah. I hate using it.
Okay.
That's why I go by drugs. Which that sounded so bad, but that's why I go off of estimated drug cost is because that's actually a better read for me when I do the plans. You can do it however you want. I'm just going to teach you my way of doing it just because
Yeah.
it makes sense, right?
Okay.
So once I come in here, I have the ability of filtering this, and just to show the example on it. So I'm going to go ahead and do this low max out of pocket one. I'm going to do this Humana one, and I'm going to do this WellCare. I can pick 3 different plans at any given point in time to compare. So the first thing that I'm going to do is that, and when you look at this stuff right here, there's a few things that I want you to call note. Some of these do not have the providers listed. And it's just depending on whether the carrier supplied the information to Connecture or not. Other ones, we may have issues with the doctors where they have said that they don't want to show up on any of these types of online tools. And that is the doctor's choice. It isn't that they're not in network. It's that the doctor has said, I'm at capacity. I don't want anybody to see that I'm taking new patients. So don't put me listed anywhere. If you have a doctor that is a part of a major hospital system, your protocol needs to be that 1, you check to validate that, yes, they are tied to a major hospital system. 2, that they are actually a full-fledged doctor. So if they're a resident or an intern, they do not count. Then you want to go ahead and see, 1, do you have the spelling of their name correct? So Google them to make sure that that's correct. And then if the name is correct, they aren't recently married, and they have a major hospital system affiliation, then you have to call the broker support at the carrier and say, hey, this guy's not showing up. Can you validate, is he in network or not? He's a part of Cleveland Clinic. They will actually, their call centers for all major carriers have another system that they go into that is for networking that will say, yes, they are really in network, but they're not showing on the online tools as requested. Or they'll say, nope, no dice. And then you can go from there. But that should be your protocol. Okay.
Could they not show on SmartEnroll and show on the carrier's website itself when you look up a provider?
I'm sorry?
Could they not show on SmartEnroll, but if you went, for example, to the Humana site, would they show up there even if they're not?
It's possible. And typically in October, when the new systems roll out, it is possible that they can show on one and the other. Normally in October, when the new functionality comes in, I hate that they don't give us a week to go ahead and test it, and make sure that the validity is right before it goes live across the entire agent community. And this is for any of these systems. The information is only as good as what the compatibility and the uploads are. And there's literally hundreds of thousands of lines of data that get updated. And yes, there is room for error on that. Typically mid to late October is when the systems actually for doctors end up getting updated so that way they actually reflect correctly. Good question. So once I've gotten my 3 plans that I want to compare, I can click compare now. Excuse me. And what you have the ability of doing is lining them all right up so that they are neck and neck, and you compare them all together. Now, the first thing that you can see is this shows you I'm not licensed for this Imperial one, which means I cannot email a quote that has this particular plan in it because I'm not authorized to talk about it. But it also shows you that they can enroll and I can quote either of these 2 Humana or WellCare plans because I am licensed and appointed to go ahead and sell those too. Now, why am I looking at all of these? Because I want to make an educated decision as to, does this make sense to present to her or not? So as you can see, we're going to go line item by line item to take a look at it. So, you know, we've got 0 premiums. The max out of pockets are different. And we're going to look at all of these benefits. Do they make sense? Do they not? What's happening here? I personally don't like that this is a 20% coinsurance for outpatient mental health. I think that that's a little lackluster. Now, if we go ahead and we continue to look at this, you've got the inpatient hospital stay that's at a 0 copay. So their hospital is nothing. That is insane to me. We go ahead and we look a little bit further. When I look at their drug costs, the drug costs look great, but let's go ahead and let's take a look. Now, I have the ability of pulling up summaries of benefits. I can pull up paper copies of all of the other information, and I have the ability to see, okay, who's in network or out of network. And these links will take you to the carrier sites, to various places to get the information to validate. It also shows you what's covered and what's not. So, and it also shows you the possible options for this particular med. Now, when you talk to a client, you can't tell them, well, this isn't covered. You have to have your doctor rewrite a script for this different medication. You can't do that. You can only use it as a suggestion as to a cost alternative, right? Tells you whether or not their pharmacies are in network, and it also tells you if they have the ability of buying additional dental or not, or the OSBs, the optional supplemental benefits. That is what this is. This is not the stuff that is built into the plan. When you want to find that type of information, you can click into the plan details. And then basically you have all the things, and it's basically an electronic version of summary benefits. So it shows you all of the max out of pocket, all of the different benefits. It shows you the diabetic supplies, over the counter at 45, and how often that is done. You've got your meal benefits, your dental stuff, your eyes, your hearing, fitness benefits. You have all the things right here, and it's all electronic. So this allows you, when you are scrambling trying to find a PDF of something because you need an updated copy, or you have a meeting with somebody that you forgot and you don't have your kits yet, or you ran out of kits, you can come right in here, run a quote, pull the PDF and print it out, and you're good to go. So if you need to do that last minute, it's all here. And as you can see, you have everything in here. You have your summary of benefits, you have your evidence of coverage, you have your benefits at a glance, you have the applications, you have your OSB information, you have your plan ratings. So all the things that CMS says that need to be made available to the beneficiary, they're all right here for you to go ahead and use as reference. And you want to continually download from running a quote like this so that you are using the latest information and most up-to-date information that you have, right? So that's what this does. The next tab that I want to show you is, let's say we need to go ahead and change this. So instead of using Walmart, she really uses the mail order. I can click this, and as you can see, those numbers just changed from, she goes to Walmart, it's $908 for the year for the drugs. If she goes to mail order, it's going to cost her $12.90. So it's actually beneficial for her to go to the drugstore every month than it is for her to go to use mail order, which is surprising because that's normally not the case. The next thing that I want to show you is click into the prescriptions tab. This shows you how the prescriptions are classified, and it shows you what the estimateds are going to be. So as you can see, the generic here on a mail order, 3-month supply of simvastatin, doesn't cost her anything. The gabapentin doesn't cost her anything on this plan. The Lantus, this, because it's a 3-month supply, it is $35 times 3. And that's how you go ahead and you get that number, just like this one, because of that's the cap on it. Then you have it where this estradiol, the gel isn't covered, and this is the average price based on the script that she has. So we would continue to look for what this is. The thing that I do want to tell you, this retail cost that's right there, that is the estimated, because there is nothing regulating the cost of medicines right now. The government doesn't have a regulation put in place. What ends up happening is that can change by the wind blowing. So this is where you want to go ahead and say this is an estimated, because that cost today may be $450. In 6 months, that may be $1,200. And with there being quote unquote shortages of medications that are out on the market, you want to do an estimated cost on that. Okay.
Are the other ones set? The price?
No, retail cost is never set. The before gap is a co-paid amount, so those numbers are set. The 95 is set, and the coverage during the gap is going to be set because it's based on what the plan coverage is. But the retail cost and the after gap, those are always going to change because they're typically a percentage of what the plan is, or what the cost of the medication is. So that is what this is. At the top here, I can change and edit the prescription list. So if we need to switch to a generic, we need to switch things, we can. We need to pull medicines off, we can do that. But that's what you want to do. I typically play in the plan detail in the prescription section, but that's how you do it. So theoretically, let's say I want to go ahead and I want to send this to her. When you send somebody a quote, so let's say I want to send her the Humana and the WellCare. Even if I don't X this out, it's not going to let me send it. So what I can do is I'm going to have to pull this one out. And now the functionality comes here that I can send the quote. So I'm going to click into this and I'm going to send it to her cell phone again. And I'm going to say, please review the quote. Please let me know if you have questions. You will receive 2 text messages. Helps if I learn how to type. And then it asks me, so it shows you I'm sending the Humana and the WellCare, and I have this where the prices is based on the Walmart pricing, and I'm going to send this to her. And then in the event when she gets that, from that point, my rating numbers are embedded into it. So if I never talk to her again, or she decides that she gets it and decides, okay, I got this, screw it, I'm just going to enroll myself, you don't have to worry about whether or not you are getting credit for it. You are, it's already built in. Okay, so I'm going to send this out. I can again put up the follow-up note. It also shows me the authorization number. So as I said, it's going to show she's going to get 2 text messages to set up and call up that quote, right? And I can set up the follow-up on that. What is also going to go ahead and happen from here is I can go in and on my dashboard, so let's say it's 2 days later and I need to call back up what I just did with her. What I can do is come into the search button, type in her first name, hit search, and here she is, right? Now she is a registrant. That means that she has not applied for anything. She's just here hanging out and we're still looking and talking. So I can click into the Kim test. And you're going to see that I have history of everything that's happened. We've got our scope information. It was completed on 8/4. We have the task that was done because it was completed out. If I scroll down, it shows you exactly the quote that I sent, the time that I sent it, the number I sent it to, what plans I did, and the note that I put in here along with the access code. So it gives you full historical ability for you to see what you did with that client at any point in time, right? So now let's say that she ends up going ahead and she wants to come in and she needs to, let's say she decides that she wants to enroll in that plan. Which I should have hit the different link, but that's okay.
Amanda, is there a place in there to put if she schedules a meeting?
You can put it in the notes section.
Oh, okay.
And where you put the reminders with the date, does that then show up in agency block?
No. It shows up here. It does not talk back the back way. Now they may have updated for 2024, but currently I don't believe it does it. So
Question.
let's
I see on the top, it says start call recording. So right now, we haven't done anything that needs to be recorded because it's all digital. So I would assume the call recording will link with our Zoom setup.
So if you're taking an enrollment over the phone, then yeah, you can, or through your Zoom. I would record it through your Zoom, not through this.
Okay,
Or through your, you can use it if you want through here. I don't recommend it. I would do it through your phone, through your regular phone. But you only need to record if you are doing a telephonic enrollment or a internet Zoom-based, video-based enrollment. So right now,
only during enrolling. What about, when you're discussing plans? Isn't that an enrollment call?
it is.
Okay,
But everything that I was doing, I wasn't doing with a client. I was showing you how to do it. I prepared the quote and sent it to her. She's playing with it on her own currently. I haven't come back at her yet.
thank you, Amanda.
Yep. So if I'm actually coming back at her and meeting with her, I'm normally going to do that as a face-to-face. And if I'm doing it as a face-to-face, I can pull up the quote, pull it in, and then hit the add to cart. And then start the enrollment process right here, which is where we're at. The other thing that I can do is I can look at, you can do paper and then hand key this in if you need to. That's another option. There's multiple ways to go ahead and do it. So with this, I hit the add to cart. I'm ready to apply. She's good to go. First question, and it even tells you the disclaimer, hey, do you really want to do this? Because it's showing that this doctor is not in network that you're signing her up for. So yes, we can keep it and proceed, or nope, we're going to go ahead and move it and we're going to fix it. Great catch. It stops you from making a mistake. The other thing is that it's going to ask you, just like it, do you want to add the OSBs on? If you do, great. If you don't, no big deal. And as you can see, are we sending this to the beneficiary? Or are you going to complete this yourself because you have them right in front of you, or because you have a paper version available? So if I go ahead and I hit this one because I'm sitting with them, then what we're going to do is hit apply. And now it's going to take you directly into Humana's site to complete the application and go. I'm not going any further than this, guys. Because if I do, it's going to trigger something on their end, and that's never good. But that's actually how you do the enrollments if you're doing them, and it's super easy. I lied, I'm going to do this. The electronic version mimics identically to a paper application. So it's going to have all the things. You've got how do we need to call them, contact information, you've got your addresses, then it's going to go into Medicare ID numbers, effective dates, all the different things. And as you can see on the side, you have all of the electronic versions of anything that you may need as well. And you're going to progress. So you're going to watch as this goes through each of these different steps. And then from there, you're good to go when it comes to that. Once you have submitted an application, what happens is you as the agent is going to get an email that says that so-and-so submitted an application and it is and it's in your system. What is going to happen is that that person, when we go to find them, is going to go and see how his name changed to applicant. So this tells me that he submitted an application. So not only do I have the email, I have that as well. The other thing that is going on is when I click into his file, you are going to see that one, all of this is protected, but then you have it where it shows you the quote that I sent him, the 2 plans, the 3 plans that I sent him, that he applied in the plan 2. I have when he applied, which was June 11th for a 7/1 effective. It gives me the confirmation of when it went, and it gives me a PDF version of the application. So I can download this and I can put it in my CRM if I need to, because I know many of you like to keep those records. You can download that. And then it's going to, the first page is typically going to be a transmittal that it shows you all the things of what this is. And as you can see, it verifies that I am the writing agent for this particular policy. There's the plan that he submitted, when he submitted it, and I have a tracking number so that way I can trace if this doesn't get submitted or something's not showing up on the end, I have recourse, right? And then I have a copy of the entire application as it was filled out. All the things. It is basically the electronic version of what was submitted, including his drugs and everything else. So this way we know that we check. If they say, if he claims that we didn't check his doctors and that I was negligent because I did that, well, guess what? No, I'm not. I can show you right there that I checked his doctors. I can show you that I checked his medications. So if you're claiming that I didn't verify a medication or a doctor, it wasn't given to me at the time of sale. So now I am not, it gives me those concise records, right? So this is how I know what they've been on and everything else. From this point, you need to go into that carrier's website to get your writing, the member ID, verify that it was actually processed, that there wasn't a problem with the application. All of those things are done at that point, and then you're good to go. So that is basically a soup to nuts way of how this actually works and all the different tools that go along with it. I have 3 minutes. So what questions do you guys have?
If you have agency block, do the applications go into agency block automatically then, once they're accepted?
No.
Okay.
You have to download them because some people want them, other people don't.
Amanda,
Go ahead.
I have a very specific question. When I go to do a med sup application, and I try to add non-licensed plans, it doesn't bring up any non-licensed plans for me.
For med sups, it won't. That'll only work for PDP and advantage plans.
Okay.
You can only quote, the system will only allow you to quote what you were licensed for supplements.
When I take classes from United Healthcare, the trainer there says for med sups, it's really important to use United Healthcare's website instead of any other website. Do you have any idea as to why?
Probably for tracking purposes, but what ends up happening is that these systems automatically load into and plug into their systems.
Thank you.
Other questions? Okay, I have a minute before my next class starts on the events. So I am going to say thank you for playing. It was good to talk with you guys. I will offer these again. I am also going to put the replay up shortly. So once that happens, you'll be able to reference this in the protected part of the website. And I will probably get it a couple of other places. So stay tuned. Otherwise, have a great weekend, guys. And I will either see you on the call that starts in 60 seconds, or I will see you on Monday when we do our team call. So have a great one, guys. Thank you.